When I decided that I wanted to have a transplant, I called a transplant center, and that's how I started getting enrolled. The transplant center took my call, and that's how I started my evaluation.
You have to go down and have the team at the transplant center interview you. They ask you a lot of health questions. They type and cross-match your blood to get a match.
The first test they gave me was they took 15 vials of blood. That was my first experience, which did not bother me whatsoever. I thought the ball is rolling now. This is where I wanted to be. And then after that, it was just a host of other tests. They checked me from one end to the other, you know.
Today we're going to do the EKG that tells us your heart rate and rhythm. We're going to do the chest x-ray that's looking at your lungs. And we're going to do a lot of blood work that tells us everything from how anemic you are to how good or bad your kidney function is, to what viruses you've been exposed to.
Hi Francisco, my name is Martha. I'm your financial coordinator. Anything to do with insurance issues is me you're going to contact.
I'm a little concerned about the cost of the transplant. What can you tell me?
We have all the details of your transplant benefits here. We're going to review all of your out-of-pocket costs because there's a lot more costs involved than just what your insurance is going to cover.
How could getting a transplant affect me financially?
The cost of the medical test and surgery for kidney transplants are covered by Medicare and your private insurance. However, you might have to take vacation time from work or pay for things like childcare, gas, meals, parking, hotels, and those would not be covered. Receiving a kidney transplant may also impact your ability to obtain or afford health or life insurance.
Who would pay for the cost of the anti-rejection medication?
Most of the anti-rejection medicines, which can be expensive, are covered by Medicare for 3 years following transplant surgery. If you're over the age of 65 and have Medicare, Medicare will continue to cover the cost of most anti-rejection medicines for the life of the transplant.
I am over 65.
Good, so this would apply to you.
Yes.
So for the patients that are under the age of 65 and receiving Social Security disability for medical reasons other than kidney failure, they also may be entitled to additional drug coverage past the 3-year period.